The way I've usually done prostate operations, if they're bigger prostates, is with a transurethral resection of the prostate.
The gold standard is TURP, but some men who are older, you worry about fluid absorption or post-TUR syndrome. Who have cardiac histories, you're worried about the fluid absorption. You are a little bit worried about visibility sometimes. With the laser TURP, specifically the biolytic here, there's hardly any blood loss.
The first time we used it, we were very impressed. It opened up completely the prostatic fossa. There was little or minimal bleeding at the time, and the patient did extremely well, went home the same day without a Foley catheter, and has done well since. The BioLitech EVOLVE laser is much different than previous side-fire lasers. 15 years ago, we had side-fire lasers. Now, with this laser, we can actually vaporize the tissue, which leads to patient responses quicker and less problems for the patients regarding frequency and dysuria.
And I've used the older method, archaic method, you might say, of looking through a lens. I've never gone to the using the screen like most people do, or at least all the younger doctors do. And I figured I was getting close enough to retirement that I didn't have to worry about learning that technique. But within a very short while, I not only learned to use the screen method to move around and move my scope, but I was getting good results with the laser technique. It worked quite well.
The visibility in terms of lack of blood loss, there's hardly any blood loss, and if the little there is, the laser takes care of it and coagulates very quickly and easily.
The 980 nanometer wavelength works well for vaporization. It's also extremely good at coagulation for blood. So combining those two factors, this laser does a great job at what really needs to be done, that being removing the prostate tissue with minimal or no bleeding.
It really wasn't that much more difficult than doing a TURP. It was easier, actually.
In terms of being minimally invasive to the patient, it's certainly there, and it's a nice alternative and option to the standard TUR.
Utilizing a prostatic block in the office, as well as utilizing a intracystoscopic injection of lidocaine into the bladder neck area, we're able to do these lasers in our office completely without any other monitored anesthesia available.
It was so safe that developing the technique was, I felt so much easier and faster than the others. That's why I liked it. And I don't think that, I mean, someone like myself, it's not usually worthwhile, going to a newer technique. But with this, I thought it was easy to do, and so I did it.
Compared to other modalities that we've used as in-office minimally invasive therapies for BPH, the immediate results are really apparent. You don't have to wait the 6 weeks to start seeing patients get better. They get better very quickly with minimal dysuria, minimal bleeding, and a very small need for catheterization, if at all.
It's easy enough to handle that I plan personally to have the same procedure done to myself within the next 3 to 4 months.